Sheffield, March 1945. The rain fell in sheets across Camp 17 at Lodge Moor, turning the parade ground into a mudslick that reflected grey sky and greyer buildings. Margaret Fisher stood with 11 other German nurses as a British medical officer approached, clipboard in hand, boots splashing through puddles that seemed to mirror the uncertainty in her chest. Behind him, 3 military lorries idled, engines rumbling like distant thunder. The officer spoke in clipped English about emergency medical shortages, about temporary assignments, about regulations being adapted to meet unprecedented need. The 12 nurses looked at each other with expressions that asked questions nobody could answer. They were prisoners of war, enemy nationals. Trained medical professionals being offered something impossible, the opportunity to work in British civilian hospitals, treating wounded soldiers who had fought against Germany, caring for the very people they'd been taught to hate. What happened over the next 8 weeks would demolish every assumption they'd constructed about enemies, about duty, about what it meant to choose healing when war said you should choose sides. Margaret's story began 9 months earlier in June 1944, when Allied forces captured the field hospital where she'd been working near Caen. She was 26 years old, trained at Berlin's Charité Hospital, daughter of a physician who had taught her that medicine transcended politics. She had joined the Deutsches Rotes Kreuz in 1941, had served on the Eastern Front before being reassigned to France in early 1944. She had seen men die from wounds that would have been survivable with adequate supplies, had watched the Wehrmacht's medical system collapse under pressure it wasn't designed to withstand, had developed the professional detachment necessary to function when horror was constant and resources were never sufficient. The propaganda had prepared her for Allied savagery. Stories of Americans executing medics, of British refusing medical care to German wounded, of systematic cruelty toward anyone wearing Wehrmacht grey. She had heard tales of captured nurses being mistreated, of medical personnel worked to death in labour camps, of Geneva Convention protections ignored when enemies wanted revenge more than they wanted civilization. She had steeled herself for the worst, had hidden her nurse's certification initially, thinking civilian status might offer more protection than medical credentials. Instead, the British processing at the temporary detention facility was methodical and surprising. Medical examinations that actually verified her nursing qualifications, documentation that recorded her training at Charité, her 3 years of wartime service, her specializations in surgical assistance and trauma care, British officers who looked overworked rather than sadistic, a system designed around cataloguing skills rather than punishing enemies, then transport to England, days on a ship across the Channel, then trains north through countryside that didn't match the devastated wasteland German propaganda had described, through industrial cities still functioning, past hospitals with red crosses clearly marked, alongside British civilians who stared at German prisoners with exhausted resignation more than active hatred. Margaret pressed her hand against the train window, watching this enemy country pass by, trying to reconcile what she saw with what she'd been told to expect. Camp 17 sprawled across 40 acres of moorland outside Sheffield. Built in 1940, it had been expanded repeatedly to accommodate the flood of prisoners from every theatre. By March 1945, it held over 1,200 German POWs in the main compound, and in a separate, smaller section, 47 German women, including 12 nurses, 8 clerical workers, and 27 dependents. The women's section was different from the men's. Smaller barracks with actual beds rather than bunks, a common area where women could maintain fragments of normal life, could sew, could read, could speak German without guards immediately interrupting. Medical facilities staffed by British personnel who treated German patients with the same clinical efficiency they'd offer anyone. Not warmth exactly, but competence. Not brutality either. Margaret was assigned to Hut 6. She shared the space with 5 other nurses: Helene Bauer, 32, veteran of 4 years on the Eastern Front, hands that trembled slightly from what she didn't talk about. Ingrid Schaefer, 23, younger than her experience suggested, trained in Hamburg, captured at Arnhem. Clara Vogel, 29, from Munich, soft-spoken with eyes that had seen too much. Elizabeth Kohl, 34, senior among them, former head nurse at a Wehrmacht hospital in Poland. Annette Werner, 24, from Frankfurt, whose brother had been killed at Stalingrad and who couldn't reconcile grief with the strange kindness of British captivity. They adapted to camp life with the pragmatism of medical professionals who'd survived worse. The food was adequate, if bland. The accommodations were Spartan, but weatherproof. The work assignments were light, sorting medical supplies in the camp warehouse, maintaining inventory, tasks that used their skills without putting them in contact with patients. They existed in suspended animation, waiting for war's end, waiting for repatriation, waiting for permission to return to whatever remained of Germany. In February 1945, Britain's medical system reached breaking point. The final push into Germany generated casualties at rates that overwhelmed existing capacity. Military hospitals filled beyond design limits. Civilian hospitals absorbed the overflow, staff working double shifts, triple shifts, sustained exhaustion that degraded care quality when care quality mattered most. The Ministry of Health issued emergency directives. Utilize all available medical personnel, all available, including qualified German nurses held in POW camps, if protocols could be established to make it acceptable. The proposal generated immediate resistance. British nursing unions objected to enemy nationals treating British soldiers. Hospital administrators cited security concerns, liability issues, the simple impossibility of maintaining proper custody while allowing prisoners to work in civilian facilities. Military command worried about Geneva Convention implications, about public perception, about the optics of German nurses caring for wounded Tommies while British boys died from inadequate staffing. But the mathematics were undeniable. 12 qualified nurses sitting idle in Camp 17, while Sheffield Royal Infirmary operated at 140% capacity, with staff collapsing from exhaustion. The policy debate went up chains of command, through bureaucratic reviews, through careful risk assessments. In early March, authorization came through with extensive conditions attached. German nurses could be assigned to civilian hospitals under armed guard supervision. Duration: 8 weeks. Renewable if successful. Security: military police present at all times. Restrictions: nurses confined to assigned wards, no unsupervised contact with patients, no access to medications without British supervision. Subject to immediate removal if any incidents occurred. Colonel David Preston, Camp 17's commandant, called the nurses together on March the 12th. He explained the opportunity, the restrictions, the fact that this was voluntary. Nobody would be forced to work in British hospitals treating British soldiers if they objected on moral or political grounds. It would not affect their treatment as prisoners. It would not influence repatriation timing. It was simply an option being offered because qualified medical personnel were desperately needed, and they possessed qualifications that could save lives. Margaret listened and felt something complicated stirring. She was a nurse. She had spent 5 years treating wounded men regardless of which uniform they wore, which language they spoke, which flag they fought for. The Hippocratic tradition didn't recognize nationality, but these would be British soldiers, men who had been shooting at Germans days earlier, men whose survival meant German defeat continued. Was treating them betrayal? Or was refusing to treat them the real betrayal of everything medical training meant? She raised her hand. What kind of cases would we be treating? Preston consulted his papers. Primarily surgical recovery and trauma care. The hospitals need nurses for post-operative monitoring, wound care, medication administration, basic nursing duties under British supervision. Helene spoke up, her voice steady despite the tremor in her hands. Would we be treating only soldiers or civilians as well? Both. The hospitals have mixed wards due to capacity issues. Military and civilian casualties integrated wherever beds are available. Clara asked the question they were all thinking. What happens if we refuse? Preston met her eyes. Nothing. You remain here, continue your current duties, receive the same treatment as always. This is an offer, not an order. The 12 nurses looked at each other. Margaret saw her own conflict reflected in their faces. The opportunity to practice their profession again versus the complexity of healing enemy soldiers. The chance to save lives versus the question of whether those lives would continue fighting Germany. The professional calling that transcended politics versus the political reality of who they'd be serving. Margaret spoke before she could reconsider. I'll do it. Helene nodded. I will also. One by one, all 12 volunteers stepped forward. Not from political conviction, not from collaboration or betrayal, but from the simple fact that they were nurses first, prisoners second, and watching people die when you possessed skills to prevent it was intolerable regardless of nationality. Sheffield Royal Infirmary occupied a Victorian complex in the city's northern district. Built in 1897, expanded repeatedly, it was overwhelmed by March 1945. Corridors lined with beds because wards were full. Staff working shifts that blurred into continuous duty. Supplies stretched thin, medications rationed, everything operating at the edge of acceptable standards while casualties kept arriving. Matron Dorothy Henshaw, 51 years old, career nursing administrator, received notification of the German nurses' assignment with reactions ranging from pragmatic acceptance to barely concealed hostility. She had lost a nephew at Dunkirk, a brother in North Africa. The idea of German nurses working in her hospital felt like insult added to injury. But she'd also been working 18-hour days for 6 weeks straight, had watched 3 nurses collapse from exhaustion, had seen patients suffering because staffing was inadequate. Mathematics overcame emotion. She needed nurses. Nationality was secondary to competence. The 12 German nurses arrived at Sheffield Royal on March 15th at 0800 hours. They were processed through security, assigned identification badges, briefed on restrictions through a translator hired specifically for this program. Margaret barely heard the words, only understood. You'll be working Ward 7, surgical recovery, British supervision at all times. The guards accompanied them through corridors that smelled of antiseptic and blood, and the distinctive odour of hospitals operating beyond capacity. Past wards, where wounded soldiers stared at them with expressions ranging from confusion to suspicion to open hostility. Past British nurses who looked exhausted enough that even enemy nurses represented relief. To Ward 7, where 32 beds held post-operative patients in various states of recovery and pain. Sister Agnes Thornton, 38 years old, head nurse of Ward 7, waited with an expression that suggested she'd rather face German artillery than supervise German nurses. She spoke to them through the translator, her tone clipped and professional. You'll work under my direct supervision. You'll follow my instructions exactly. You'll have no independent decision-making authority. You'll treat patients as I direct, using procedures I specify, with medications I approve. Any deviation will result in immediate removal. Understood? The 12 German nurses understood. They were being given the opportunity to work under conditions of absolute distrust. Every action monitored, every decision questioned, every task performed with British nurses watching for mistakes or sabotage. Not colleagues. Supervised enemies allowed to help only because desperation overwhelmed caution. Margaret was assigned to beds 1-8, 8 patients requiring post-operative monitoring, wound care, medication administration. Agnes accompanied her to the first bed, introducing her to Private William Matthews, 22 years old, recovering from surgery to remove shrapnel from his left leg, sustained during the Rhine crossing 3 weeks earlier. Matthews stared at Margaret with open confusion. "She's German?" Agnes nodded curtly. "She's a qualified nurse. She'll be assisting with your care under my supervision." "German nurse treating British soldiers?" Matthew's confusion shifted towards something like betrayal. "That's not right." Agnes's expression suggested she agreed, but regulations were regulations. "She's here because we're understaffed. You'll treat her with the same respect you'd show any medical personnel. She'll provide you with competent care." Margaret approached Matthews's bed, every movement careful and professional. She checked his chart, noted his vital signs scheduled for monitoring, began the routine assessment she'd performed thousands of times: temperature, pulse, blood pressure. Matthews watched her with suspicion, and something else. Pain. Inadequately managed, evident in how he held himself, how his jaw clenched. She turned to Agnes. "His pain level appears significant. When was his last morphine administration?" Agnes checked the chart. 4 hours ago. He's not due for another dose for 2 hours. Margaret studied Matthews, recognized the signs of a patient suffering needlessly. His physical presentation suggests inadequate pain control, elevated heart rate, shallow breathing, muscle tension. 2 hours is medically inadvisable. Agnes bristled. "I'll determine what's medically advisable in my ward." "Yes, sister." Margaret's tone remained professional. "I'm only noting clinical observations based on my training." Agnes stared at her for a long moment, then checked Matthews's vital signs herself, verified what Margaret had reported. She made a notation on the chart. "I'll consult the physician about adjusting his pain management schedule." It was a small victory. Permission to observe and report, if not to act independently. Margaret moved to the next bed, and the next, conducting assessments that revealed a ward running on exhaustion and insufficient staffing. Patients whose wounds weren't being cleaned as frequently as protocols required. Medication schedules that prioritized rationing over optimal pain control. Post-operative monitoring that couldn't happen as often as medical necessity demanded because there simply weren't enough nurses to maintain proper standards. By midday, Margaret had assessed all 8 of her assigned patients and documented every concern. Agnes reviewed her notes with an expression that shifted from hostility toward grudging acknowledgement. The German nurse was competent, more than competent. Her observations were clinically sound, her documentation was thorough, her patient interactions were professional despite language barriers requiring translation. Agnes gathered the German nurses at the end of the first shift. "You performed adequately today. Tomorrow, you'll have more responsibilities. We'll assess your capabilities gradually. Any questions?" Margaret raised her hand. "What is the typical nurse-to-patient ratio in this ward?" "Currently, 1 nurse to 16 patients per shift." Margaret tried to hide her shock. "In Germany, our standard was 1 nurse to 8 patients for post-operative care." Agnes's laugh was bitter. "In Britain, our standard was 1 nurse to 10, but standards don't matter when you're running on half the staff you need." She paused, something softening slightly in her expression. "Which is why you're here. We need help, even if it comes from the wrong side." Over the following days, the German nurses integrated into Sheffield Royal's operations. They worked 12-hour shifts under constant supervision, performing tasks that British nurses verified at every step. They changed dressings on wounds inflicted by German weapons. They administered medications to men who'd been fighting against Germany. They monitored vital signs, recorded symptoms, provided comfort to patients who were technically their enemies, but were primarily just men suffering from injuries that transcended nationality. The British soldiers reacted with mixed confusion. Some refused treatment from German nurses, demanded British personnel exclusively. Others were too sick or too exhausted to care who provided relief from pain. A few expressed something approaching gratitude, recognized that these German women were choosing to help despite obvious complications. Private James Henderson, 24, recovering from burns suffered in a tank fire, spoke to Margaret on her 3rd day. You don't have to be nice to me. I know what side you're on. Margareta adjusted his bandages with practiced gentleness. I'm on the side of helping people who are hurt. That's what nurses do. But we're enemies. Right now, you're a patient. That's all that matters in this room. Henderson was quiet for a moment. Did you treat German soldiers the same way, when you were working for your side? Yes. Wounded men all look the same. They all bleed red. They all hurt. They all deserve care regardless of which uniform they wore before they ended up in a hospital bed. Something shifted in Henderson's expression. Not trust, exactly, but recognition. This German nurse believed what she was saying. Medical care transcended the war that had created these injuries. Healing was healing, regardless of politics. The breakthrough came during Margaret's second week. A patient in bed 4, Corporal Thomas Wright, developed complications from his abdominal surgery. His temperature spiked to 104 degrees at 0300 hours, well beyond normal post-operative fever. Margaret, working the night shift under minimal supervision, recognized symptoms of sepsis developing, infection spreading, blood pressure dropping, consciousness fading. Wright needed immediate intervention or he would die before dawn. She found Agnes, woke her from exhausted sleep in the staff room. Bed 4 is septic. He needs antibiotics immediately, IV fluids, possibly surgical intervention to drain infected tissue. Agnes checked Wright herself, confirmed Margaret's assessment. The corporal was deteriorating rapidly, septic shock imminent. She made the call to the on-duty physician, initiated emergency protocols. Wright was taken to surgery at 0430 hours. Infection drained, antibiotics administered at maximum dosage. He survived because the German nurse recognized symptoms early, because she insisted on immediate action, because she fought for a British soldier's life with the same intensity she'd fought for German soldiers throughout the war. Agnes found Margaret at the end of that shift. You saved his life. If you'd waited until morning rounds, Wright would be dead. Margaret was exhausted from 16 hours straight, running on adrenaline that was fading. I did what any competent nurse would do. No, Agnes was firm. You did what an excellent nurse does. You recognized a crisis, you acted appropriately, you prioritized your patient's survival over politics or convenience. She paused, something fundamental shifting in her demeanor. I owe you an apology. I assumed German nurses would be incompetent at best, dangerous at worst. I was wrong. Margaret met her eyes. You were protecting your patients. That's what good head nurses do. I would have done the same if British nurses had been assigned to my ward in Germany. The incident became hospital legend within days. The German nurse who'd saved Corporal Wright. The enemy prisoner who'd fought for a British soldier's life when she could have stayed silent, could have let complications go unreported until morning, could have chosen sides rather than choosing healing. Staff attitudes shifted, not to complete acceptance, but to professional respect. These German nurses were competent, more than competent. They were medical professionals who took their duties seriously, regardless of nationality. The 12 German nurses developed reputations across their assigned wards. Helene's surgical skills made her invaluable in the operating theatre, where her steady hands assisted with procedures that saved limbs and lives. Ingrid's trauma experience helped her manage the most critical cases with calm efficiency. Clara's gentle manner made her perfect for pediatric cases, treating children injured in bombing raids with tenderness that ignored nationality. Elizabeth's administrative skills helped streamline medication distribution, improving efficiency across multiple wards. Annette's language skills made her the unofficial translator, bridging communication gaps between German nurses and British patients. British nurses who had initially resented their presence began seeking their assistance. Agnes started delegating more responsibilities to Margaret, trusting her clinical judgment, treating her less as supervised enemy and more as valued colleague. The guards still accompanied them everywhere, but monitoring became less about preventing sabotage and more about satisfying security protocols that everyone recognized were becoming formalities. In late March, something unexpected happened. Sister Mary Fletcher, 42, veteran nurse working Ward 3, collapsed during her shift, overwhelming exhaustion, finally defeating determination. She was admitted as a patient, diagnosed with severe fatigue and malnutrition, ordered to bed rest for a minimum of 2 weeks. Ward 3 needed replacement coverage immediately. Matron Henshaw made a decision that would have been unthinkable 4 weeks earlier. She assigned Margaret as temporary head nurse for Ward 3, with minimal British supervision, with authority to make clinical decisions independently. Not because Henshaw had forgotten Margaret was German, but because Margaret had proven herself competent, reliable, and capable of managing a ward during Britain's medical emergency. Margaret stood in Ward 3 and felt the weight of unexpected trust. 20 beds, 20 patients, half military, half civilian, all requiring care that she would coordinate, would oversee, would be responsible for. The guards accompanied her, but they positioned themselves at the ward's entrance, watching rather than hovering. She was being given autonomy, limited, conditional, but real. She gathered the 3 British nurses assigned to support her. I know this situation is unusual. I know you didn't expect to work under German supervision. I'm not here to impose different methods or challenge British procedures. I'm here to maintain care standards while Sister Fletcher recovers. If you have concerns about my decisions, voice them immediately. Patient safety requires us to function as a team regardless of nationality. The 3 British nurses exchanged glances. Then the senior among them, Nurse Patricia Holmes, 28, extended her hand. Understood, Sister Fisher. Let's keep these patients alive. The handshake was brief, professional, but it represented something larger than gesture. Acknowledgement that in this ward, for these weeks, German and British nurses were colleagues first, enemies second, united by shared purpose that transcended war. Ward 3 flourished under Margaret's management. She implemented protocols from her Charité training, improved medication scheduling efficiency, reorganized patient monitoring to catch complications earlier. She worked 18-hour days, slept in the staff room when exhaustion overwhelmed her, functioned on the same sustained adrenaline that had carried her through field hospitals on the Eastern Front. British nurses watched with growing respect. German efficiency was real, but so was German competence, German dedication, German commitment to patient welfare above all other considerations. In early April, a patient in Ward 3 changed everything. Flight Sergeant Robert Lawson, 29, recovering from injuries sustained when his Lancaster was shot down over Germany. He'd been held as POW for 3 weeks before being repatriated through prisoner exchange, arriving at Sheffield Royal with untreated fractures and infected wounds from inadequate German medical care. Lawson recognized Margaret immediately, not personally, but categorically. German nurse treating him after German captors had nearly killed him through medical neglect. He refused her care, demanded British nurses exclusively, became agitated when Margaret approached his bed. She didn't take it personally. She assigned Patricia Holmes to Lawson's primary care, removed herself from his direct treatment. But she monitored his condition carefully from distance, reviewed his charts, tracked his recovery trajectory. She recognized what British staff missed. Lawson's psychological trauma was as significant as his physical injuries. He woke screaming at night, panicked at German voices in nearby wards, exhibited symptoms of what would later be recognized as post-traumatic stress. Margaret approached Lawson during a night shift when the ward was quiet. "Sergeant Lawson, I know you don't want my care. I respect that. But I need to tell you something important. Your physical wounds are healing properly, but you have other wounds that aren't healing. You need to speak with someone about what happened in Germany. Pretending you're fine won't make it true." Lawson stared at her with hostility that barely masked fear. "Why would you care? You're one of them." "I'm a nurse who's seen too many men suffer from wounds that aren't visible. I treated German soldiers with the same trauma you're experiencing. It doesn't heal itself. It gets worse if ignored. German soldiers don't have trauma, they're the ones causing it. Margareta was quiet for a moment. Everyone who experiences war experiences trauma. German, British, American, Russian. Bullets and bombs don't care about nationality. Neither does the damage they cause to minds and bodies. She left him then. Didn't push, didn't force conversation he wasn't ready for. But she spoke to Matron Henshaw the next morning, recommended Lawson receive psychiatric evaluation, explained her observations about psychological injuries requiring treatment as essential as physical ones. Henshaw listened, made the referral. Lawson was evaluated, diagnosed with severe traumatic stress, began treatment that would continue for years. He never thanked Margaret directly, but weeks later, before his discharge, he stopped by Ward 3, found her changing bandages, waited until she finished. "I wanted to say something," he began awkwardly, "about what you said, about trauma." Margaret waited. "You were right. I needed help. I was pretending I was fine when I wasn't." He paused. "I hated that it was a German nurse who saw it when British staff missed it. But I'm alive because you noticed. So, thank you." Margaret nodded. "That's what nurses do. We see the things patients try to hide." Lawson extended his hand. Margaret shook it. Two people on opposite sides of war, connected by recognition that healing required acknowledging all wounds, visible and invisible. The 8-week assignment ended in early May 1945. Germany surrendered. The war in Europe was over. The German nurses were scheduled to return to Camp 17, then eventual repatriation to whatever awaited in occupied Germany. Before leaving Sheffield Royal, something unexpected happened. The hospital staff organised a farewell gathering. Not official, not formal, but real. British nurses who had worked alongside German nurses for 8 weeks, who had started as hostile supervisors and become something approaching colleagues, wanted to mark the end of this unusual collaboration. Matron Henshaw spoke briefly. "When you arrived, I didn't want you here. I thought German nurses in British hospitals was wrong. I was mistaken. You've served with distinction, saved British lives, maintained professional standards under difficult circumstances. You've demonstrated that medical competence transcends nationality, that healing is healing regardless of politics. Britain owes you a debt we cannot easily repay." Agnes Thornton presented each German nurse with something small but meaningful. A nursing badge, British design, engraved with their name and dates of service at Sheffield Royal. "So you remember that you were nurses here, not prisoners. So you can tell people that British nurses recognised your competence, your dedication, your commitment to healing above all else." Margaret held the badge, felt metal warm in her hand. Fought tears that professional training said were inappropriate, but humanity insisted were necessary. She tried to find English words adequate to this moment. "Thank you for trusting us, for seeing us as nurses first, for teaching us that enemies can become colleagues when united by purpose larger than war." The 12 German nurses returned to Camp 17, then were repatriated to Germany in June. They returned to a country devastated, occupied, barely recognisable. Margaret settled in Berlin, found work in a hospital, struggling to function with minimal resources and overwhelming patient load. She carried her British nursing badge, kept it displayed, despite complications of being seen with enemy commendations. Agnes Thornton and Margaret Fisher corresponded for 37 years. Letters crossed between England and Germany, becoming more than just updates. They became friendship forged in impossible circumstances, when war had made them enemies, but medicine had made them allies. Agnes visited Berlin in 1958, detoured to meet Margaret in person. They sat in a cafe in what had been East Berlin, drinking coffee, talking about those 8 weeks in 1945 when German nurses had worked in British hospitals, when healing had transcended hatred. "You changed how I see enemies," Agnes said. "Before you came, Germans were just the people who killed my nephew. After working with you, Germans became people. Some good, some bad, all complicated. You taught me that. Margaret nodded. You changed how I see the British. I expected cruelty. I found colleagues. That matters more than I can express. Margaret Fisher died in 1987 at age 68. Her obituary mentioned a distinguished nursing career, post-war work rebuilding German medical infrastructure, dedication to training new nurses in both technical skills and humanitarian values. It didn't mention 8 weeks in Sheffield, the British soldiers she'd helped save, the enemy hospitals where she'd proven that healing transcended nationality. But her family knew, and they told the story at her funeral. How Nurse Margaret had looked at wounded British soldiers and seen only patients needing care. How she'd fought to provide competent treatment despite being supervised enemy. How she'd demonstrated that medical professionalism required no translation. Agnes Thornton died in 1991 at age 84. She died in Sheffield, having spent her entire career at Royal Infirmary, having trained countless nurses in technical competence and humanitarian values. Her last words, according to colleagues, referenced those 8 weeks in 1945. The German nurses taught us something important, that healing is healing, regardless of who needs it or who provides it. We should never forget that. The nursing badges Agnes gave the German nurses were donated to medical museums documenting wartime medical services. Margaret's badge sits now in the Berlin Medical History Museum, evidence of an impossible collaboration, of enemy nurses working in enemy hospitals, of healing transcending hatred, even in war's final months. The story became part of historical record. Researchers studying wartime medical services cite it as an example of how professional competence could transcend national enmity. Nursing historians reference it when discussing evolution of international medical cooperation. But the deeper meaning isn't in academic analysis, it's in the simple fact that 12 German nurses and dozens of British nurses chose to work together despite everything, that healing transcended politics when given opportunity, that enemies became colleagues when united by purpose larger than war. Ward 7, where Margaretti first worked, has been renovated countless times. Nothing remains of the space where German nurses proved their competence to sceptical British staff. But in Sheffield Royal's archives, there's documentation. Nursing schedules showing German names, patient charts with notations in slightly accented English, Agnes Thornton's evaluation reports documenting competence and dedication that exceeded expectations. 8 weeks after German nurses arrived expecting hostility, they left having earned respect. That transformation from supervised enemies to valued colleagues represented everything complicated about war's end, about occupation, about the possibility that professional standards could provide common ground when politics demanded division. The regulations said, supervise them constantly. The regulations prioritized security over collaboration, assumed enemy nurses would be incompetent or dangerous, or both. But one ward, then another, then an entire hospital demonstrated that competence transcended nationality, that healing required no translation, that nurses united by shared purpose could work together regardless of which side they'd fought for. Sometimes the bravest thing you can do is trust enemies to be professionals first. Sometimes healing transcends the conflicts that created the wounds, and sometimes the impossible becomes possible because people refuse to let war define every interaction, because medical duty demands treating patients regardless of politics, because nurses on opposite sides recognize each other as colleagues first, enemies second, healers above all else. The badges remain, the letters remain, the historical record remains. Evidence that in March 1945, in Sheffield, German nurses and British nurses became something neither expected. Colleagues united by commitment to healing, professionals who chose competence over nationality, enemies who discovered that medicine provided common language stronger than war's divisions. And in that collaboration, however temporary, however constrained by war's context, They demonstrated something that transcends historical documentation: that healing is healing, that nurses are nurses, that professional dedication recognizes no borders when patients need care.